Assalamu alaikum, everyone. I'm here today to talk a little bit about the criticism that sociologists face. Regularly, we're asked the question why we don't stay in one area of research specialization. And the answer to that really is what I'm going to share with you here today. I started my research and PhD on sociology of health. But I couldn't stay there. I started navigating into sociology of education and sociology of religion because these substructures of society are linked together. And without understanding all of them, we can't understand one specifically. So when I was interviewing nurses for my PhD research, an interesting population group that they highlighted that was neglected or marginalized was the elderly population in Pakistan, which stands at 16.4 million. This is a rough statistic because we don't really know what the rural and the remote population's reliable statistics are. And so it could possibly be more than that. At the same time, as a researcher, I was very worried about the interaction between our elderly population, which is rising. According to United Nations, in another 10 years, there will be 15% of our population above 60 years population group. But our youth population, which at the moment stands at 140 million, and their interaction was something that was interesting me. And so definitely what the nurses were telling me, that we are working in the morning at public sector, and when you go to Pakistan's tertiary care public sector hospitals and ask them for geriatric wards, they're going to tell you that there's no such thing. We don't have dedicated healthcare services for the elderly at tertiary level or at primary level when you're visiting basic health units and rural health centers. And some of them shared that they may visit private sector old age homes when they're called by the aging residents. Rarely, sometimes. And I wanted to go into these old age homes. I was lucky to get access to public sector old age homes and visit these aging residents. And I wanted to understand their quality of life. But because it was anticipated that their quality of life indicators would be negative and not so good, I did want to plan an intervention. So at first stage, the cross-sectional research revealed that the elderly in Pakistan living in old age homes are suffering from loneliness, isolation, mental health issues, sleeplessness. But what was also being indicated was that there may be some possibilities for solution and resolution. I'm going to highlight the first figure over here. You can see the outer borders, boxes, which is telling you that the participants that were part of my research were the baby boomers and the Gen Z. But during this intervention for intergenerational learning literacy, after the cross-sectional research, because we want to, as sociologists, get to a resolution and give social policy recommendations, we wanted to also have other generations in between to facilitate the process. So the Gen X and the Gen Y, or the millennials, were also part of the research project, performing different roles. They were data collectors, intervention facilitators, participant observers. And in a nutshell, what we found from the intergenerational learning exercise, that these 10 learning activities yielded the most positive results. I'm going to zoom in and talk about 2 of the activities, and not all of them, the ones that yielded the most positive results. But before that, I'll tell you that the old age homes were a setting which were lucky for us. We were able to highlight not just the conflict and the problems, but we were also able to highlight where we can come about in terms of harmony and cohesion. So during this 3-month journey of an intergenerational learning literacy intervention, we found that elderly participants and youth responded to 2 areas very positively: the Did You Ever activity and the oral history narrations. And a little bit about why this yielded such positive results. When the elderly were able to share oral narrations from the past and participate in a Did You Ever activity, they were able to share lessons from the past, their values, their cultural traditions, how they lived their lives, and most importantly, they felt valued over this 3-month period. They felt heard. The previous people that they were interacting with, even if they were visitors or family members or old age fellow residents or staff of the old age home, did not have that time for them. And in turn, the youth were responding very favorably. They were developing empathy. They were understanding where the elderly came from. So some bridges or some bricks were starting to align. But you must be thinking that with artificial social experiments like this, how do you facilitate the conversation and how do you move it forward so that you can replicate it in real life? And so I'm going to share the facilitation prompts that we used for this intervention. There were lots of them. And I do encourage all of you to read this research. It's published online so that you can get this intervention content in detail. Social workers are using this when they are planning family counseling. And some of those facilitations, which is what I'm going to zoom in on, some of those facilitation prompts like, what did you eat? What did you do with your parents? How were you brought up? What was your form of physical exercise? This is the way to keep the conversation rolling and not let it be halted in any way. So when we asked, and I'm going to talk about one particular incident, when we asked the elderly, well, how do you remember being brought up by your parents? One elderly resident shared that they woke up at 5 a.m. in the morning, performed household chores, and then they earned their breakfast, got ready for school, and went to school. Vice versa, one of the youth participants shared that their parents were setting screen time for them, and at 11 p.m. at night, their father put off the Wi-Fi router, and so it was bedtime. So here, a clash was evident. The elderly responded by saying, well, you're spoiled. The youth is spoiled. They're overly dependent. Everything is free for them. Electricity is available. Free delivery is available. Technology, instant communication. They don't know how to be prepared for real life and real life's troubles and challenges when they hit them. Vice versa, the youth responded with empathy. They felt that the elderly were being abused and mistreated as children. And in fact, they felt bad for them that now in their old age, their children had abandoned them in old age homes. You'll remember that in Pakistan, it's still a stigma to live in an old age home. You're expected to be taken care of in your own homes and by your relatives. And so definitely one big learning during this intervention was that the youth were responding with empathy first, but over the 3-month period, the elderly were also responding. They discovered, it was a discovery for them that the youth have their own set of challenges. They're burdened by economic pressures, academic pressures, social media, having to be the best at social media and being the best with digital literacy. And so they had their own share of problems and challenges. And so what did we learn from an intervention like this, which we can replicate in real life? We can, and I'm going to talk about one structure each. For example, so these pictures are shared with consent, of course. One thing that we can start changing at the workplace is to start adding intergenerational mentorship programs. It's possible. We can bring in retired populations and ask them to mentor the youth. In turn, the youth can share their digital learning and their new emerging skills. When we turn to the family sector, they can start having weekly intergenerational activities and storytelling sessions. It's a start. You must be thinking weekly is not enough, but it's a start. Pakistan is a very conservative nation, so I think the religious authorities and the religious centers have a big role to play for them when they start introducing intergenerational dialogue and how resilience and coping strategies is built by this kind of solidarity. The universities and schools are already doing a great job, what you're doing right now. But I would recommend that this needs to be integrated into formal curriculum. Intergenerational programs such as narrating oral histories and transferring them to digital repositories, it's possible. We still have baby boomers who are alive, and if we put them together with our youth, there's great potential to store information from the past and use it for future generations to use this information. Sociologists, one final area that I'm going to talk about. Sociologists have also zoomed into not planning direct interventions for intergenerational solidarity, but partnering them with interventions for active listening, patience, tolerance, Because if you noticed in this intervention that I talked about, that was the key, that the youth were willing to listen and the elderly were willing to be patient and also listen. And finally, what's really important is literacy and awareness for why intergenerational solidarity is important for countries like Pakistan. Number one, the social protection law that we're planning, or social policies that we're planning, it's not fair to just burden our youth and tell them that you need to plan state interventions. It's not possible. The state interventions for social support and social protection need to be partnered by family-level care. Grandchildren looking after their grandparents, grandparents swooping in with financial help when their grandchildren need it. Simultaneously, nation building and development is not possible without the youth and elderly generations coming together to share skill sets, experiences, and professional resilience. And finally, I'll leave you with a note. If you do a content analysis for the speeches of Quaid-e-Azam, Muhammad Ali Jinnah, the slogan that he came up with, unity, faith, and discipline, whenever you hear his messages when he's addressing the youth, he's telling them, don't forget your parents. And when he's addressing the elders, he's saying, we are doing this, we are fighting this fight of liberation for our future generations. So Quaid-e-Azam didn't just stand for bringing in and integrating our religious minorities and ethnic minorities, but also bringing in our generations together. And if I have 1 minute left, I'll tell you that I'm not an expert. I'm struggling every day. My children sometimes don't want to talk to me. My mother sometimes kicks me out of the room. So it's a work in progress. We just don't give up on each other. Thank you so much.